For the purpose of this assignment, we'll analyze the case of 62-year-old male Mr. David Nadsel with no stated allergies who attended emergency department. On admission, his posture and positioning was tripod and he appeared to be having severe respiratory compromise with a barrel chest. He was presented with fever and sore throat with a productive cough which contributed to worsening of COPD associated with a new COVID-19 infection, which was confirmed 3 days prior to his visit. He has been a smoker for more than 30 years. However, he quit smoking after being diagnosed with COPD 10 years ago. He is currently suffering from COPD, hypertension, and hyperlipidemia. This case highlights the importance of A to G assessment along with some of the important nursing intervention and medication which could help in management of COPD. Let's start with Mr. Nazel's A to G assessment. Mr. Nazel's airway is clear, meaning he can maintain it independently. However, he is using accessory muscles to breathe, which indicates an increased effort. This requires close observation. His respiratory rate is 30 breaths per minute and his oxygen saturation is 78% on room air, which is below target range of 88 to 92% for COPD patients. We can hear some diminished breath sounds, wheezing, and crackles, which suggests there is an obstruction or infection in his airway. These findings prompt us to initiate controlled oxygen therapy. Mr. Nazel is experiencing sinus tachycardia with a heart rate of 128 beats per minute and blood pressure of 168/85 mm of Hg. Combined with capillary refill of more than 3 seconds, these signs indicate cardiovascular strain from respiratory distress. His GCS score or Glasgow Coma score of 14 out of 15 suggests that Mr. Nazel is slightly confused, likely due to low oxygen levels. Regular neurological checks are necessary to monitor his condition. He is febrile with intact skin and IV line in place. His fever suggests that there is an ongoing infection which is confirmed by elevated white blood cells and CRP levels. Now let's move forward to discussing high priority nursing intervention that could play an important role in Mr. Nazel's case. Now, let's discuss the 4 high priority nursing intervention for Mr. Nazel's COPD exacerbation. Firstly, administered controlled oxygen therapy. This is crucial to maintain his oxygen saturation between the range of 88 to 92%, which is a target range for COPD patients. It is important to avoid administering too much of oxygen as this could lead to hypercapnia. Next, we'll also administer nebulized bronchodilators, specifically salbutamol and ipratropium. This medication helps to reduce bronchospasm and improve the airflow, providing much more needed symptom relief. It is essential to give this at regular intervals to ensure consistent bronchodilation. We will also monitor his recessed atrial blood gases every 4 hours. Frequent monitoring allows us to track the changes in oxygenation, carbon dioxide retention, acid-base balance, which is crucial for adjusting respiratory management as needed. Finally, we need to administer intravenous antibiotics such as erythromycin. COPD exacerbations are often triggered by infections, and since Mr. Nasal shows a sign of infection, administering antibiotics is essential to target any bacterial cause. These interventions are vital for effectively managing his condition and promoting a healthy recovery. Now, let's go over to the nursing consideration for specific therapies and medication that have been administered to Mr. Nazil. Let's start with oxygen therapy. We need to continuously monitor his oxygen saturation, respiratory rate, and the signs of CO2 retention. Careful titration is necessary to avoid hypercapnia in COPD patients. Second, with salbutamol, a bronchodilator that reduces bronchospasm, will monitor for improvement in breath sounds and wheezing reduction, while also being aware about the side effects like tachycardia and tremors. For ipratropium, which is an atrovent, another bronchodilator, which reduces the airway resistance and requires monitoring for its side effects as well, such as dry mouth, urine retention, and many more. Moving forward, we can talk about prednisolone, which is a corticosteroid which is used to reduce inflammation but can also cause hypercalcemia and mood changes. So, monitoring blood glucose level is essential while giving this medication. Next would be erythromycin, an antibiotic that helps to treat infection. We need to monitor the signs of infection resolution, such as reduction in white blood cells count and C-reactive protein levels, along with watching for the side effects like GI upset or liver dysfunction. Lastly, we'll look into nirmatrelvir and ritonavir, which are antivirals given to manage COVID-19. It's important to monitor drug interactions and progression of viral symptoms with common side effects including gastrointestinal upset and elevated liver enzymes. In conclusion, Mr. Naz's conditions required an immediate comprehensive intervention to stabilize his respiratory and cardiovascular status, which could be done by conducting a thorough A to G assessment, implementing some of the key nursing interventions such as administration of controlled oxygen therapy, use of bronchodilators, and so on. We could help him stabilize his condition and the overall outcome of improve the overall outcome. Thank you for paying attention to my presentation. Thank you for your attention, and I'm happy to answer all the questions that you may have. Thank you.